I am so happy that I get to talk to you today about labiaplasty. We'll talk about surgical labiaplasty specifically. Surgical labiaplasty is often reserved for those women who feel like they have very long, elongated, redundant labia minora. Labia minora are those inner lips. We have outer lips and inner lips, and those inner lips sometimes jut out beyond the outer lips and can cause, frankly, discomfort. Oftentimes, my women say that they can't wear a certain kind of clothing. Leggings or biker shorts can sometimes feel uncomfortable pressing on the labia. I've heard stories where women have to actually tuck in the labia into their underwear or into their bathing suit. Um, Various reasons that somebody would want to have a labiaplasty. Regardless of the reason, there are several different techniques for actually doing the labiaplasty. I am very proficient in several of the techniques. There are certainly no one size fits all techniques. Um, you really have to examine the patient, see where the abnormalities are, see which technique would suit them the best, and then employ that technique. The two most common techniques are the trim labiaplasty versus the wedge labiaplasty. With a trim technique, the edges of the labia minora are excised away, and this can be more beneficial in those patients who also don't like the darker color at the edges of their labia. It can sort of get rid of that darker color. The wedge labiaplasty is where you take out a little pie-shaped wedge from the labia minora and close that gap. So um, the outer perimeter of the labia minora is still the same outer perimeter that the patient has now, but overall the size of the labia minora has diminished. So certain labia are better served with trim labiaplasty, and others are better served with um, a wedge labiaplasty. So during your consultation, we would certainly go over what your expectations are, what your discomforts are, and we can come to a decision as to what would serve you best.